This is TTT Live. I'm DK Roster. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candace Alcantara.
Good morning. We are pleased that you are back with us today for the Ministry of Health's virtual media conference, which provides an update on the Ministry's COVID-19 strategy. Here to share the latest COVID-19 updates with us are Dr. Avery Hines, Technical Director of the Epidemiology Division, Dr. Alana Best, County Medical Officer of Health for St. Andrew St. David, and Mr. Roshan Siram Singh, our GIS Manager. I am Candace Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this morning's media conference. We go to Dr. Hines for today's clinical update.
Thank you, Ms. Alcantara. Good morning to Dr. Best. Good morning to Mr. Siram Singh. Good morning to members of the media and members of the viewing and listening public. I'd like to go straight into the slides for my presentation as they contain our clinical and epidemiological updates. Next slide, please. As at the date, the 23rd of March 2021 at 4 p.m., we would note that we have tested 106,802 samples at both public and private facilities, with 50,000 or so, nearly 51,000 having been done at the private facilities. Of those, 7,865 would have tested positive, and we will have 7,573 recovered patients thus far. We've had 141 COVID fatalities, the most recent being another elderly male with pre-existing conditions, and again we extend our condolences to the members of the bereaved families. We currently have 151 total active positive cases, and those are distributed as follows. There are 134 individuals in home self-isolation, there are 13 individuals in hospital, and there are 4 new positive cases. We currently have no one in step-down facilities, and there are 277 individuals in the state quarantine facilities. Next slide, please. Looking at the epidemiologic trends, we bring the now familiar epidemic curve up onto the screen, and we see that that large grey portion to the left represents the trends from end of July through to the end of December 2020. And the colored portions represent green for January, blue for February, and March is in orange. The dotted black line that we see running through the graph represents what we call that rolling 7-day average, meaning the average number of cases that we would have had over the preceding 7 days. And the most important fact or factor to note with this is that we see the upward climb, the upward slope or slant of that dotted line. We see those orange bars representing the number of cases for the month of March getting progressively higher. We see that whereas the blue bars for February were quite short, they're quite low, they're quite small, compared to January, we see that the March bars are higher than February, lower than January, and it means that we're seeing an upward trend that we're taking note of, and we would like to advise additional caution and precautions as we move forward to reduce that risk. Next slide, please. One of the things that we spoke about previously and that we're bringing back to the table is really a practical demonstration of how many individuals one infected case can infect. Now, this is not the sum total of all the contacts that would have been exposed by the infected cases. This is really just the demonstration of the number of people who have turned positive as a result of that exposure, mainly within that County Caroni area. Looking again at the color coding, the red circles indicate what we call index cases, the first case in a chain. The purple ones indicating the primary contacts of those index cases, and those primary contacts could be at home, at work, in any other setting where people come together, for example, in settings of gathering. And then the blue circles representing contacts of those contacts, so what we call secondary contacts. And what we see is that this virus passes quite easily and quite effectively through these layers. So you see both primary and secondary contacts becoming positive as a result of exposure to these index cases. And what we really do want to emphasize is that where we have the opportunity to identify that someone is infected, we do the contact tracing, and when we do that contact tracing, we do ask all of the contacts, primary, secondary, and actually tertiary, to remain in what we call quarantine. And in so doing, what we hope to do is to protect the rest of the population, the people with whom these individuals may interact, from becoming infected by them if they themselves become infected, as we are seeing happens quite frequently, using this hierarchical diagram as an example. We'll speak a little bit more about this a little later on in the presentation, but let's move to the next slide. The next slide really just re-emphasizes the important points on how to self-quarantine, so that when persons are asked to remain in quarantine, we do want to emphasize that there are several things that we should be taking into account, and that these guidelines are on the Ministry of Health's website. So we do want to emphasize that if you are in quarantine, then you are to remain at home, that no one should be coming to visit you in your home, that enhanced hygiene precautions should be practiced, the washing of hands, both when you're interacting with things in the household, surfaces, etc., as well as when you interact with pets and the pets that you may have in your household. Clearly, once someone is in self-quarantine, the hygiene precautions around not sharing items, cups, towels, that sort of thing, those things need to be borne in mind. And we do want to encourage anyone who starts to develop symptoms while they're in quarantine to practice even further enhanced precautions by isolating themselves within the home, by wearing their mask, by reaching out to the health authorities that will be following up with you, because the county medical offices of health do assign individuals to follow up with those in quarantine and to verify whether you're having symptoms or not. So if you're having symptoms, you can reach out to them even before they reach out to you and say, I'm having the following symptoms, what do you advise? And then they can give you advice on whether you should continue to isolate at home or whether you should seek additional care. So it's really important that even as we do the home isolation, the home quarantine, that we emphasize these points. The person who was the index case in the family, they should be wearing their mask, they should be doing the enhanced hygiene precautions, they should be isolating themselves even within the home. And the other members of the family following the precautionary measures, and if any symptoms develop, you reach out to your county medical office of health liaison for further instruction. In so doing, what we hope to do is to reduce the number of people that become ill after having been in contact with these index cases. So bringing that epidemiologic bit to a close, one of the important things we'd also like to emphasize is the virus has not gone anywhere. The threat of COVID-19 spread still remains with us, and all of the precautions that we have been advocating still apply. We note that when you go out, you interact, there's always that risk that you may interact with someone who's asymptomatic, and in so doing, you may bring virus back home to your family. So we want to emphasize the importance of everyone following all of those preventive guidelines when we are out and about, the wearing of the mask, the watching your distance, the washing of hands. These are important things that are actually helping us right now. They've been working so far to keep the numbers low, and although we know that it's been a long run, it's been a long haul, and people may be getting tired of trying to stick to these behaviors, we've come too far to turn back now. We've come too far to actually give up on these functioning measures. We want to encourage us to hold the fort and to continue. So I'm going to turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines, for those words of encouragement and those important reminders. The GIS, or the Geographic Information System Unit of the Ministry of Health, is really key to providing information to support the national response. And today we have with us again the GIS Manager, Mr. Roshan Siram Singh, to present to you an update this morning.
Thank you very much. Dr. Hines, Dr. Best, Ms. Alcantara, members of the media, and members of the listening and viewing audience this morning. Good morning to you all. As we move across quickly to our first map, which is on the other slide, we will see what we call a week-on-week map, a map which we use to compare cases in the immediate past week to the week immediately preceding that. So in this particular case, we are comparing cases recorded during the period the 14th to the 20th of March to the 7th to the 13th of March, with the 14th to 20th being represented in the yellowish color and the 7th to the 13th being represented in the purplish color. And what we are seeing here is, again, County Caroni, as we have been discussing over the last few days and few weeks, has recorded the highest number of cases. And what we've noticed is that when comparing the weeks, there were less cases in County Caroni in Epi Week 11, which is the 14th to the 20th. However, we also started to see an increase in other counties. If you were to look at County Victoria, if you were to look at County St. George East, St. Patrick and St. George West to a lesser extent as well, we are seeing cases coming on more and more in those counties. So this speaks to the spillover effect, which CMO would have mentioned on Monday. And it speaks to us on the need for us to continue to practice the measures, the COVID-19 measures which have been put in place, because COVID is still here, and it is just as dangerous as it was before. So we need to continue to do our part and become even more vigilant as we work towards getting back to a place of normalcy. As we move across to our other slide, what we do is we take a look at the spread of cases 1 month ago. So we look at the spread of cases during epidemiological weeks 6 and 7, which covers the period the 7th to the 13th of February, and of course the 14th to the 20th of February. When looking at this map, it's quite clear that less areas were affected, but the highest number of cases in any of these areas highlighted was 6 cases, and that was in one little area there in San Fernando. Now compare this to what we have recorded during Epi Weeks 10 and 11, which we see in the other slide. As we look at this other slide, we see that not only are more areas affected, but the number of cases in these areas, in many of these areas, would have also increased. So when we look at the previous map and we saw that there were 6 cases being the highest number of cases in any particular area, and we look at this particular map and we see that 16 cases is the highest number of cases in any particular area, we see that that change is there. The numbers have been increasing, and we are also seeing it here on the map. When we look at the map as well, and this is what the map allows us to do, when we look at the data spatially, we see that that general Chase Village, Karapi, Chima, Balmain area around there, those areas are what we would say hot areas, areas in which we would have recorded a high number of cases. And of course, these are areas we need to look at. Of course, there are other areas which would have recorded a relatively high number of cases in the east and other parts of central and in south as well. As we move across to our other sets of maps, we take a look back at our cluster maps. Just to point out that the criteria used to generate these maps and to determine these clusters would have been a minimum of 3 cases within a 1 kilometer search distance. And of course, each map we see represents a period of 2 weeks. So we look back to epidemiological weeks 4 and 5, which really covers the period the 24th of January to the 6th of February. And then we look at Epi Week 6 and 7, which covers the period the 7th of February to the 20th of February. And what we see is that during Epi Weeks 4 and 5, there were a significant number of clusters. In fact, there were 11 clusters at that point in time, with 6 of these clusters being recorded in that Port of Spain to El Dorado area. 1 in the east, 2 in central, near to that Chagonas and environs area, and 2 around the San Fernando area. But as we look at epidemiological week 6 and 7, covering the period 7th to 20th of February, we saw that the number of clusters decreased significantly to 3. 1 being in Chagonas, 1 being in San Fernando, and 1 being in that Diego Martin area. So the decrease in the number of clusters were noted. However, we also note that Chaguanas and San Fernando, both in Central and South, maintained at least one cluster during that period. As we move to the other slide, we see now maps for epidemiological weeks 8 and 9, and 10 and 11, with epidemiological weeks 8 and 9 representing the period 21st of February to 6th of March, and epidemiological weeks 10 and 11 representing the period 7th of March to 20th of March. So during epi weeks 8 and 9, we see only 2 clusters, again a decrease when compared to epi weeks 6 and 7. But the same 2 areas, Chaguanas and San Fernando, recorded clusters again. Now, compare this to epi weeks 10 and 11. We would have seen a significant increase. From 2 clusters, we went up to 10 clusters, of which 6 of these are from the central area, as you can see on the map. So there would have been a dip in the number of cases, and we are seeing it here in the number of clusters as well, and there was a subsequent increase during epidemiological weeks 10 and 11. Now, as we go to the other slide, we take a look at the counts per cluster, and we see that the majority of clusters identified during epidemiological weeks 4 and 5, that is 24th of January to 6th of February, would have recorded 3 or 4 cases each. However, there were 2 among those clusters which recorded 6 cases, and 1 recorded 5 cases. Looking ahead to epidemiological week 6 and 7, 7th of February to the 20th of February, with only 3 clusters identified, 2 of these contained 3 cases, and 1 contained 6 cases. Looking across at the other slide now, we look at epidemiological weeks 8 and 9 first, covering the period 21st of February to 6th of March, and with only 2 clusters. We had 10 cases, 7 cases in one cluster and 3 in the other. Now let's take a look at epidemiological weeks 10 and 11 from the 7th to the 20th of March, which is to the bottom of the slide. And again, we see a significant number of the clusters identified had either 3 or 4 cases each. However, 1 among these had 6 cases, and 1 had 11 cases. So in one cluster alone, we identified 11 cases. So let's look at it a little bit differently now. As we move to the other slide, we take a look at the clusters in a simplified table form. And we see, as we compare each of the periods identified in each of the maps, we've already identified the number of clusters as 11, 3, 2, and 10 respectively. So we would have seen a dip in the middle. So we would have seen less clusters, and again, the subsequent increase during epidemiological weeks 10 and 11. Now, as we look at the total number of cases within the clusters, we also see that dip during the period epidemiological weeks 6 and 9, which is expected, given that we would have recorded over time less cases, and these would have been identified in the press releases over the period of time. Now, the highest number of cases within any cluster, as we would have gone through previously when we looked at each of the charts, would have increased from 6 to 11 during the period being discussed. Now, the number of clusters would spread within the family or the home or the same address. Again, we saw that pattern where there would have been a decrease during epidemiological weeks 6 to 9 when compared to 4 and 5, but we also see a subsequent increase during epidemiological weeks 10 to 11. Now, the maximum number of cases within any family would have ranged throughout the period. That is, any family or the same home or the same address, it would have ranged between the range essentially of 3 to 6 cases. What is interesting to note is the total number of cases within the clusters which were linked to persons either in the same family or the same home or the same address. And 21 out of the 42 cases during epidemiological weeks 4 and 5, that is 50%, would have been linked to someone else within the home or the same address or the same location. Whereas in epidemiological weeks 6 to 7, there were 12 persons, so all 12 of the persons identified in clusters during that period were linked to someone within the home. This must be considered, of course, in context, with that period generally having less cases and the spread being restricted to the home environment. Now, epidemiological weeks 8 and 9, again, must be considered in context, as 8 out of the 10 cases identified within clusters were linked to someone else within the home. Now, as we look at epi weeks 10 and 11, we see that 33 out of the 43 persons who were identified as persons within clusters, these are spatial clusters we are discussing, 33 out of the 43 were linked to someone else within a family or the same home or the same address, which is about 77%. So this is still significantly high. Of course, we don't want this to get to a point where it continues to expand, and we want to continue to practice our measures as have been put in place and we have practiced in the past so that this doesn't get out of hand. Now, as we go to the other slide, we take a look at the linkages among confirmed COVID-19 cases in County Carney. Dr. Hines would have referred to this map a little bit earlier. Now, just to reiterate that this map represents initial cases, positive contacts of these initial cases who would have turned positive, and secondary contacts of these index cases who would have turned positive. So everyone we look at on this particular chart, they are positive. Now, in identifying the linkages, Dr. Hines would have spoken to some extent earlier in today's press conference, and he would have also referred to it on Saturday's press conference. But just to compare what we would have seen on Saturday and what we are seeing today. On Saturday, we had, on this particular chart, 12 index cases, 23 primary contacts turning positive, and 8 secondary contacts turning positive, which would have totaled 43. Now, when we compare it to what we have today, adding the data which we would have had access to between this particular period, we have an increase of index cases to 21, an increase in the primary contacts to 31, an increase in the secondary contacts to 10, totaling 62. So over the last few days, we have had the increase identified in this particular chart as we continue to use such information to inform decision, because we are in the business of evidence-based decision making. Of course, as we see the linkages, we understand the need for us to continue to practice the guidelines, because it's quite easy for someone, anyone, to contract COVID-19 and share it with persons, be it in a family or be it at the workplace or whatever it is. So this slide identifies for us what we would have seen in County Carney for the period March 10th to present, and any linkages which should have been in existence to those particular cases prior to that. Now we take a look at data in County Carney again as we move to the other slide. Here we look at the confirmed cases within County Carney only during the particular period of time being discussed, which is really from the 10th to the 23rd of March, of course with a few linkages which have existed before that particular period. And here we see the spread of confirmed cases again within the area, within County Carney in particular, and we see the general areas mentioned earlier, with the Chase Village, Karapi-Chima area, the cases being recorded a little more in those particular areas. Now this is only identifying confirmed cases, and it does, while it does identify for us the impact of COVID-19, it doesn't give us a full and true picture when used alone. So as we switch to the other map, we take a look at the swabs, COVID-19 contact swabs. So for these patients we would have identified over the period of time, we would have swabbed patients, we would have had primary, secondary contacts, and they would have swabbed accordingly. And as we look at the other map on the other slide, we'll get an appreciation for just how many people were impacted and just how the impact on County Carney looks. This is not just the persons who would have tested positive. We are looking at all the persons swabbed, because when you turn positive, we go through the contact tracing process, and persons who require swabbing are swabbed. Of course, this requires resources from a management point of view, but when we look at it from a personal point of view, the families of these people are affected. They would not be able to go to work, and life as they know it, their regular lives would have to be altered. So there are various types of impacts. So really identifying all of these persons would have been impacted in some way really helps us identify what is taking place. And it helps us as we use it to supplement the map of the confirmed COVID-19 cases. Now we move across to the other slide. And today we are very pleased to share with you that we have gone live with our new COVID-19 GIS dashboard. It's a dashboard which we would have mentioned in the past, and it's one which is now available for public consumption, as you can take a look at the COVID-19 statistics and charts. Firstly, to access the dashboard, you go to Ministry of Health's website, which is health.gov.tt. We go then to the COVID-19 drop-down menu and select Trinidad and Tobago COVID-19 dashboard. Selecting that option takes us to the other slide. It takes us to the dashboard itself, which includes several components. First component being a mapping component, which was not previously available. This mapping component shows the case rates by county, and we have a second map which shows the weekly changes by county. There's also a chart component with 3 charts, one showing the new cases reported by day, the other showing age and gender distribution, as well as the proportion of cases to tests. And of course, there's the statistical component, which is in alignment with our daily press release. So that is it. We hope that you visit our dashboard. It is a source of information, official information, and we look forward to continuing to provide information in these interesting ways. Thank you very much as I hand over to Ms. Alcantara.
Thank you very much, Mr. Siram Singh. And it's a pleasure to welcome back Dr. Best to the program, and she will continue in the series of presentations that we've had from county medical officers of health who give their perspective on the COVID-19 response in their county. And Dr. Best is here from County St. Andrew, St. David. We go to Dr. Best now.
Good morning to Dr. Hines, Mr. Siram Singh, Ms. Alcantara, members of the media, and members of the viewing and listening public. Thank you for inviting me to talk with you today. My team and I cover the county of St. Andrew, St. David, which covers Sandy Grande and environs. And this means that our operations are embedded within the Eastern Regional Health Authority. Thankfully, at the moment, our numbers of confirmed cases are well controlled. At the moment, we in fact have 2 confirmed positive cases in our county. At first glance, someone might be tempted to attribute our low numbers to our low population density. Yes, it is true. County St. Andrew, St. David does in fact have the second least densely populated area in Trinidad. But one should recall that during the peak time of September, October, our county in fact bore between 10 to 15% of all the cases at one point. And so we cannot simply say that it's due to the low population density that we are where we are today. So let's reflect on some factors that might be causing our current caseload. And there are in fact a multitude of factors that are facilitating this success. And these are not complex factors. First and foremost, it's the simple public health measures of wearing face masks, washing our hands, and watching our distance that are central to controlling the spread of COVID-19. And this cannot be overstated. We have to ensure that our noses and mouths are covered, that we sanitize our hands with at least 60% alcohol, or wash our hands with soap and water often. We are to maintain a distance of about 1 to 2 arms lengths away from others. And the consistent wearing of these face masks is critical. Our team has witnessed the significant impact that appropriately wearing a face mask has on controlling the spread of COVID-19. I would like to encourage us all to wear our face masks when we are not around our usual household contacts. And this, of course, means that if we have visitors to our homes, or if you are visiting another family member in a different home, everyone should be wearing a face mask. At this juncture, it's important to remember that we should not be offended when persons that we are familiar with wear face masks in our presence. That is some of the feedback that we have been getting. In our county, we would have noted, when we had high numbers, we would have noted that a lot of the cases came from workplace scenarios. And because persons are familiar and comfortable with each other, they may drop the ball and interact at work without wearing their face masks as they should. It is important to consistently wear your face masks around your colleagues. It is not a sign of disrespect. It is in fact a sign of you being careful and considerate of the other person. One of the points during the day that we have to be mindful to be more vigilant is during the lunch hour. Obviously, when you're eating, you cannot then wear a face mask. So you can choose to eat by yourself, arrange staggered eating times in your office, and when you are not eating, you should put on your face mask. Personal choice to adhere to the public health guidelines is crucial to containing the spread of COVID-19. There are other facilitators to containing the spread of this disease, and employers, you have a significant role to play here too. Employers ought to be careful to ensure the regular sanitization of frequently touched surfaces in their businesses. One of the strategies that we have used within the Eastern RHA is to have a daily morning check-in with staff. Within the ERHA, each supervisor has a check-in process with their team members, which might be a group of about 5 to 10 persons. The supervisor checks in to ask the team members about the presence of any symptoms, but will also ask about whether the employee is awaiting the results of a COVID swab test, or whether the employee is known to have been in contact with a known COVID positive patient. These daily prompts help to highlight potentially ill employees and safeguard the organization's operations by reducing exposure for other members of staff. As in other counties, our public health inspectors continue to play an important role in sensitizing not only business places, but also schools to ensure that the appropriate public health measures are implemented and sustained. At this time of year, our inspectors are verifying food establishments as being fit for the sale of food, and so they also make use of this opportunity to reinforce COVID preventive measures at these establishments. We understand the importance of regular engagement with our community, and our health education department has provided virtual outreach programs to non-governmental organizations, religious and community leaders on the prevention and control of COVID-19. When we recognize that there is a particular locality in our county where there's been a spike in cases, we have the local mic men circulate in the area to remind residents of what they can do to protect themselves and so limit the spread of COVID. Our health system does not operate in a silo, and so we are also thankful for the efforts of other agencies. Back in January 2021, there was a newspaper article that highlighted that the Sandy Grande Division had issued the highest number of tickets for failing to wear face masks. Having this level of enforcement is important to encourage behavior change. We are now at the end of March. We know that the school term is ending this week, and so we have to look ahead. And I'd like to remind parents that camp activities are not currently permitted. We have to continue to safeguard our children, and certainly families can do things as a unit, and where possible, these could be outdoor activities or in areas that are well ventilated. For religious leaders, we know it's the Easter time. It is also a good idea for you to have a list of persons attending each service so that in the event a positive case were to arise, we can more promptly do a comprehensive contact tracing exercise. As I draw to a close, I'd like to take this opportunity to thank our healthcare teams, our nurses, doctors, attendants, pharmacists, PCAs, EMTs, clerks, phlebotomists, radiographers, public health inspectors, who continue to provide service on the front line. And a special thank you to our administrative staff who work tirelessly behind the scenes to keep the system afloat. So, we have the gentle encouragement from the Ministry of Health on a regular basis, together in conjunction with the effective enforcement by the Trinidad and Tobago Police Service. When considered all together, that is, the personal responsibility to wash our hands, wear our masks, and watch our distance, staying at home if we feel unwell, the process of prompt contact tracing, isolating and testing contacts, and then the enforcing of the law when persons fail to comply. All these factors together lead to the successful containment of the virus. None of us can do this alone. So let's keep it simple and straightforward. We all need to work together to decisively stop the spread of COVID-19. Thank you, Ms. Alcantara.
Thank you very much, Dr. Best. And we go now into the question and answer segment. Media representatives are reminded, please begin by stating your name and the name of the media house that you represent before posing your 2 brief questions, please. And please pose both questions at the same time. If we have additional time, of course, we will come back to you if you have another question to pose to the panel. We begin this morning with questions from 98.1, please.
Good morning to you again, Ms. Alcantara, and members of the panel. Stephen Cummings, 98.1 FM. My 2 questions for Dr. Hines. Dr. Hines, the WHO has our classification as community spread, yet over the many weeks we have been hearing about being in cluster category from the ministry. In my mind, I'm trying to reconcile what appears to be a variance in reporting. Is there any way that you can help bring clarity to what may be seen as a disparity in the reporting and classification? And secondly, today, March 24th, is being observed as a World TB Day, seeing that tuberculosis and COVID-19 are both infectious diseases that primarily attack the lungs, sharing similar symptomologies such as cough and fever. Can you give an estimate as to our TB population in Trinidad and Tobago, and if you can say where is TB ranked in the classification of being among pre-existing conditions or comorbidities in patients we speak about in relation to COVID-19? Thank you.
Okay, thank you for the questions, Mr. Cummings. Thank you for the opportunity to clarify what we may not have realized seems to be a disparity. The WHO and the Ministry of Health have both ranked and stated that the Trinidad and Tobago population is currently in what we consider to be low incidence community spread. Low incidence meaning relatively small numbers compared to the general size of the population. What we have been emphasizing over the past few press conferences is the linkage between some of the cases that arise in the community and the individuals to whom they subsequently pass their infection. So we speak about the clusters and we emphasize the rate at which a single case can explode into a cluster of cases. We use the opportunity to emphasize the importance of the contact tracing and of the quarantine measures to prevent these clusters from spreading into more widespread community transmission. But at no point did we say that the level of transmission was cluster as opposed to community. What we've been doing is we've been emphasizing the development of these clusters and showing sort of the temporal sequence as we go from one update to the next. We see clusters getting slightly larger as additional people already identified, already quarantined, already tested, then turn up as positives. So thank you very much for the opportunity to make the distinction between the descriptions of the clusters that we've been doing and the designation as community spread, which has not been disputed. That has remained as is since it was announced in August of last year. So whereas we may have been at high level community spread in August of last year, we've now come down to low incidence or low rate community spread, but it's still community spread, meaning that we still see cases popping up in places where there is no identified pre-existing contact. Someone may come in for a surveillance swab. They come in because they have respiratory symptoms. They are swabbed and they turn up as COVID positive. And we're emphasizing that fact because any respiratory symptom that you currently may be experiencing could be a sign of you having COVID-19, it is advisable that anybody with respiratory symptoms seeks healthcare to get that verification, and also that anybody with any respiratory symptom takes the opportunity to do the self-isolation, the removal of self from gatherings, removal of self from work, removal of self from other types of gatherings, be it church or otherwise, so that we don't increase the risk of transmission. So that community spread designation hasn't been disputed. We have not moved from that. And the risk to the general community is what we keep emphasizing when we speak about the need to maintain all of the public health guidelines and the importance of the 3 W's that we keep re-advocating: washing your hands, wearing your mask, watching your distance. Now, with respect to tuberculosis, the size of the general TB population would actually best be addressed by Dr. Trotman, who is the actual clinical specialist who manages the TB program. The ranking of TB among the causes or the comorbidities actually isn't necessarily as high as you may expect, because if you've been diagnosed with TB, you're also usually on treatment. And the individuals who have TB and subsequently may get COVID-19 are just under additional monitoring and management. And the other pre-existing conditions that we've mentioned seem to have a greater impact on outcome, those being the hypertension, the diabetes, the other immune conditions that may weaken your immune system. Those seem to be having more of an impact on your eventual possible outcome. That also, and of course, advanced age. So TB isn't ranked as highly as those other comorbidities in terms of the risk for adverse outcomes. So thank you for those 2 questions.
Thank you very much, Dr. Hines. And we go now to AZP News, please.
Hi, good morning. Privy Harry, AZPnews.com. My first question is for Mr. Sujit Singh. In terms of the 3 areas that we see a large number of cases, in Charleville, in Carrickford-Chima, and Balmain, can we identify what is that the behavior pattern that causes this sort of spread? You know, is it that they engage in a certain activity? Is it that they don't wear masks, or the person that they contracted from doesn't wear a mask? Is there anything that the ministry has found out that has caused this upsurge? First question. And my second question, Dr. Hines, this week marked the 1 year since we have closed our borders. In retrospect, do you agree that was a good thing to do at that time, or could it have waited a little longer? And what would you do differently now, after a year of the pandemic? Thank you.
Okay, thanks, Mr. Bihari. I'll actually take both questions. With respect to the risks or the behaviors that may have been identified, not just in the areas that you spoke about, but across the board. What we have seen, and Dr. St. Bernard has spoken about it, so too has the CMO, is that some of the behaviors that were admitted to included gathering indoors where not advised, and then moving from place to place with indoor gatherings. That sort of bar hopping activity was one thing that we did see. We also saw gathering indoors in a religious setting triggering another large group or cluster of cases. The workplace setting, that is another site that Dr. St. Bernard had re-emphasized and that Dr. Best just re-emphasized. One of the major risk factors there is individuals not wearing their masks while they are at work because of the comfort level, because you feel like I don't want to make it appear that I'm being scornful of my workmates. And as Dr. Best just emphasized, it's not a matter of disrespect, it's actually a matter of you taking care of others and expecting others to take care of you in similar manner by wearing the mask in the workplace, even though you're comfortable with your workmates. So that those settings, those factors have been the ones that reappear in each of these clusters, and we've been seeing it all throughout, and it's basically the same suspects, the usual suspects in terms of behaviors that we're seeing identified again with the clusters that we are currently speaking about. With respect to the borders, the 1 year anniversary, as you said, has arrived, and the choices made at the various points in time at which the decisions were made with the information available all stand the scrutiny of not just ourselves but the international community in terms of the best practice and best choices with the information available at various points in time. So to be perfectly frank, there's nothing that would be recommended to have been done differently given the fact that the outcomes in terms of protecting the population, in terms of reducing risk, in terms of managing the risk of introduction of variants, managing the risk of introduction of large numbers of positives, all of that has been the sort of consequence of having those decisions taken at the time at which they were taken. So I hope that answers your question.
Thank you very much, Dr. Hines. We go now to Wired 868, please.
Hi, good morning, everyone. Fayola Bostic, Wired 868. My first question has to do with the new cases that we've been seeing, and I'm wondering what percentage of those new cases have been asymptomatic and how that has changed over the several epi weeks that we've been monitoring them. And my second question is, the Ministry of Health issued, a statement that a letter was sent out to express appreciation for the voluntary support that the business community had been giving the government in terms of its response. I was just wondering if you could give some more details about what type of support the business community had been giving or had agreed to give. Thank you.
Okay, thank you for that question. There is a significant proportion, maybe around half, maybe sometimes a little more, of the individuals whom we have identified that showed up as asymptomatic. Now, what you'll find, though, is that because we are actively pursuing known contacts, the ability to identify asymptomatic people is actually greatly influenced by the fact that we know where to look. If you, as an index case, identify that you've been in contact with a number of people in your home, a number of people in your workplace, a number of people at a gathering, we then do the contact tracing and follow up to swab and investigate whether these individuals have become positive subsequent to their contact with you, even if they don't have symptoms. So we do pick up a fair few asymptomatics in that way. It is really around half and half, sometimes a little more, but our contact tracing is what allows us to do that. The letter of the support, it's a range of support that has been provided. I believe that information or that a statement around that has already been released this morning, and I would ask you to refer to the release to get additional detail on what you've been asking about. Or you can call the communications department for further info.
Thank you very much, Dr. Hines. We go now to Newsday, please.
Good morning, Paula Lindo here from Newsday.
Good morning.
I have two questions. One is for Dr. Siram Singh. I wanted to know how often that dashboard would be updated. And second is with the Easter weekend upcoming and people making the trek to Tobago, will there be any additional precautions put in place in terms of contact tracing by the airlines or keeping lists or anything like that? Thank you.
I believe the first question was for Mr. Siram Singh.
So let's go up to Mr. Siram Singh to respond to the first question, and we come back down.
Good morning, and thanks very much for the question. With respect to the updates, the statistical information which you would see to the right of the dashboard, as well as the three charts to the bottom, they will be updated daily, whereas the maps will be updated weekly. So that's with respect to the updates for the dashboard. Thank you.
Okay, and to respond to the second question, thank you for bringing that up. As we enter the end of the school term and the Easter holiday, we do note that there is the existing plan for a lot of movement, especially between Trinidad and Tobago. And while all of the existing contact tracing activities and provisions remain in place, and there isn't actually anything additional that can be done from our end as the health system, we do want to encourage very strongly the individuals who are traveling to exercise a great deal of personal responsibility in their planning, in their movements. If we are aware that we have plans to travel, but someone has become ill, someone has been exposed, someone's a contact of a positive case, these are the opportunities that we have to reduce risk to others by changing our plans. We do not want to have information that we've been exposed or that we are actually ill, and we take that illness with us when we travel. So really that level of personal responsibility added to the enhanced wellness, preparedness of the health system to track, to trace, to test, all of that is going to contribute together to a reduction, hopefully, in the risk of widespread transmission. We're really going to have to work together, both as a health system and a population, to ensure that we don't undo some of the gains that we have made so far by what we do over the next couple of weeks.
Thank you. We go to CL Communication now, please.
Hi, morning. Natalie Singh, CL Communications. I'm listening to the measures that were put in place for Sangre Grande, and I'm wondering if those measures will now also be heightened in Chase Village, Carapichaima, and Balmain, which you singled out. Can you just put some light on that? And then concerning the healthcare system, do you think the public is now more confident about the healthcare system given this country's response to the COVID-19 pandemic? Thank you.
Okay, I think I'll let Dr. Best respond to the measures as they apply to Sangre Grande.
To answer your first question, yes, these measures will be put in place in any area where we have seeing an increase in the number of cases. These are general measures that all counties have to that have at their disposal to respond to any increase in case numbers.
Okay, I'm going to ask if you can just sort of clarify that second question a bit. Can you repeat and clarify the second question that you asked?
Hello?
That was Ms. Singh, I believe.
Ms. Singh, yes, we just wanted to get a clarification of the second question, please. This is Nadaline Singh.
Yes. Basically, do you think now that the general perception of the healthcare system overall would be increased by the public? They'll be more confident to go to public hospitals and health institutions versus private institutions, given the country's response to the COVID-19 pandemic and all the healthcare professionals that have put their best foot forward. Do you think Trinidad and Tobago would be more confident about the healthcare system and would not have more negative comments concerning healthcare in this country?
Okay, thank you for clarifying. All we can do is make sure that the health system functions to the best of its ability. We have been doing so. We do want to actually encourage and to take the opportunity to encourage those individuals who need to seek health care to do so. Even while there is still the concern about COVID-19 in the population. One of the things that we did notice and that our health colleagues have pointed out is that sometimes people are actually a little hesitant to come seek their routine care because they're afraid of coming into contact with individuals who have COVID-19. But we do want to encourage everyone to seek your care as usual. The health protocols, the infection prevention and control protocols, the screening, etc., that's in place in the health system is there to help prevent infection exposure and the risk of becoming ill as you get into the health system itself. So we do hope, yes, that inspires additional confidence in the health system. And it's not a matter of public versus private, really. It's a matter of whichever aspect, whichever component of the healthcare system you choose to access, please continue to do so in a regular and routine manner, because it's going to help to maintain your control of your chronic diseases, of your pre-existing conditions. And if those are kept under control, then we are going to have a reduction in the risk of adverse outcomes as a result. Now, the measures that may have been noted by Dr. St. Bernard when she was here and she spoke about County Caroni, she indicated that several of those measures, this is just going back to the first question, several of the measures that were mentioned by Dr. Best have in fact been implemented in County Caroni, and it is actually it's part of the health response that the public health system mounts when there's any public health threat. So it's been described here in St. Andrew St. David. It's also in place in County Caroni, and it's one of those responses that gets mounted by any county, by any public health system, as we note an increase in trend in infectious disease or in any disease, any condition of public health concern. So just to tack on to that while responding to your second question. Thank you.
Thank you very much. And we go quickly to TV6, please.
Hi, good morning. Alicia Boucher from TV6 here. My first question is, I know, Dr. Hines, you would have stated several situations where you're seeing the increase, such as places of employment and so on. And given that sport has opened up for a bit, because I've noticed that especially in like community fields and so on, people are playing sport and they're not wearing face masks and so on. So I was wondering whether or not you are noticing any spread in relation to being linked to sport. That's the first question. Second question is, yesterday, the president of the Trinidad and Tobago Registered Nurses Association, Eddie Stewart, would have stated that although there is a spike, that spike is not a big spike in terms of numbers. I believe that 89% represents some 30-something cases. And he would have said at this point, yes, we need to be vigilant, but there's no reason for the country to panic. And that the time that we should panic is if you're seeing cases getting into the hundreds or the thousands. He used Jamaica as an example. And I was wondering, what is your view on that?
Okay, so quickly with respect to sport, no one that we have been interviewing or in contact with so far has related sporting activity or a sporting gathering as one of the settings in which they may have found themselves. However, I'd like to take the opportunity to point out that there are guidelines that are on the Ministry of Health website with respect to the safe execution of sporting activities. While you may not necessarily have the people who are playing the sport in face masks, we certainly want to discourage large gatherings, and anyone who is in attendance would definitely need to be wearing their face mask as they attend, and minimizing the numbers there. So we haven't seen that so far, and the guidelines that currently exist, if we continue to adhere to those, we would hope that those guidelines would help to prevent or to reduce the risk of spread in those settings. With respect to the statements that you've quoted, the advice that we should be vigilant but not panic is advice that I would certainly endorse. That's exactly what we have been saying here, that we want to endorse the vigilance to encourage the population to be additionally aware of the fact that we're seeing an increase in cases, so that we can modify our behaviors and so that we can actually reduce the spread by having that enhanced public health awareness, the enhanced adherence to the watching of distance, washing of hands, wearing of masks. So the point that we sit at right now is a point where we can improve our behaviors and hopefully reduce the risk, and we want to encourage everyone in the population to do exactly that.
Thank you, everyone. We have come to the end of this morning's media conference. We thank all our participants. Remember, so many of us are already doing our part, and we just want to make sure the last few persons follow the new normal guidelines, and we all continue. Today, we were reminded of the measures that we need to undertake to protect our households from COVID-19. We received a really comprehensive epidemiological update, and also we heard for the County Medical Officer of Health for County St. Andrew St. David, and she reminded us also about the health precautions that we should undertake in the workplace. Three W's again, everyone. Wash your hands, watch your distance, and wear your mask.
In crisis situations, children can perceive anxiety, which can cause them to feel stressed. Depending on their age, their response may vary.